How does MSA affect bladder control? Multiple System Atrophy, or MSA, is a rare and progressive neurological disorder that affects movement and the autonomic nervous system. This system controls involuntary actions like heart rate, blood pressure, and bladder function. While MSA shares some symptoms with Parkinson's disease, it presents unique challenges, especially regarding bladder control. In MSA, the nerve pathways from the brain and spinal cord that coordinate bladder function become impaired. This leads to various bladder problems that can significantly disrupt daily life. Early on, individuals with MSA may notice an increased need to urinate more frequently or urgently, often with little warning. They may also struggle to hold urine, resulting in episodes of incontinence, which is the loss of bladder control. As MSA progresses, these symptoms can become more severe and unpredictable. Another common issue is incomplete emptying of the bladder. The impaired nerve coordination means that the bladder may not contract properly, leaving some urine behind after urination. This can increase the risk of urinary tract infections and cause discomfort. In advanced stages of MSA, some individuals may need to use catheters to help drain the bladder, either intermittently or continuously. When comparing MSA to Parkinson's disease, it is crucial to understand that, while both conditions can cause bladder problems, MSA typically leads to more severe and earlier onset autonomic symptoms, including bladder dysfunction. In Parkinson's disease, bladder issues are often milder and develop later in the disease course. Both conditions, however, requiring careful management by healthcare professionals to maintain quality of life and prevent complications. For those affected by MSA, practical steps include regular monitoring for urinary tract infections and developing strategies to manage incontinence. Working closely with a healthcare team can help determine the best approach for bladder management, which may include medications, catheterization, or other interventions. It is essential for individuals experiencing these symptoms to seek professional medical advice. Early and appropriate management can help reduce discomfort and improve daily functioning. In summary, MSA significantly impacts bladder control by impairing the nerve pathways responsible for bladder function. This leads to frequent urination, urgency, incontinence, incomplete emptying, and an increased risk of infections. These symptoms are typically more severe and appear earlier in MSA compared to Parkinson's disease. This highlights the importance of accurate diagnosis and tailored management. Always consult a healthcare professional for personalized advice and treatment.